So welcome to week 4 lab, everyone. We're going to be looking at the upper limb this week. Hopefully everyone is caught up by now. And if you're not, please reach out to me. But we're going to be starting our online labs with week 4, which is the upper limb. Now, the upper limb we know is really important in movement. Okay, so movement of the upper extremities, as well as a lot of small activities of daily living. So lifting things, carrying things, all types of accessory functions for mobility. We'll start off by looking at some terms of movement. So these are going to be really important to understanding some of the function of the muscles of the upper limb. And I'll talk about two opposing terms of movement. One is called flexion, and flexion is basically moving a joint closer to the body. So closing the angle across a joint. So think about flexing your upper limb by closing the angle at your elbow or making your elbow, the distal part of your hand come closer to the proximal part. So that is flexion. We can also speak about extension. So undoing that action is extension. So again, with regard to the elbow, opening up the elbow joint, making that angle wider, or moving the distal part of the arm, which is the hand, away from the proximal part is what we call extension. Now we can speak about flexion and extension for all joints across the body. And so that's kind of the best way to look at that. When you're decreasing the angle, you're flexing. When you're increasing the angle, you're extending. We can also look at terms called abduction and adduction. Ab with an abduction is a motion that moves away from the midline. So opening out your limbs out to your side of your body, right? Think about pointing your fingers out towards your sides. That is called abduction. Whereas bringing your arms in towards your hips is called adduction. So movement towards the midline is abduction. Movement away from the midline is a deduction. Okay, and again, I'll use these terms as a way to sort of describe some of the function of the muscles we'll encounter. I'll also talk about pronation and supination. So pronation and supination are terms that are not only used to describe the general body, so where the body is facing. So if you're supine, you're facing to the ceiling. If you're prone, you're facing downwards to the floor or on the table. But then we can also use pronation and supination to speak about motions of the forearm. So pronating the forearm is turning the palms of the hands down to the floor. And then supinating the forearm is turning the palms of the hands up to the sky. Okay, and so we can rotate our forearm, pronating and supinating our hand respectively. Now I'll speak about function as I go on here, but I just want to make a disclaimer. You will not be tested on function, but again, I'll mention a little bit of function here just as it relates to understanding the structures. And I will also be speaking about the corresponding joints as we go through. So the first joints that we encounter in the upper limb are the sternoclavicular joint. The sternoclavicular joint is basically where the sternum articulates with the clavicle, specifically the manubrium of the sternum, which is here. And this is a really strong joint. I alluded to this earlier. This is the only area where the axial skeleton and the appendicular skeleton meet. And so it's really strong, as it has to be, in order to withstand all of the motion, all of the stress and tension that the upper extremity is going to exert. Another joint here is the acromioclavicular joint. So this is where the acromion of the scapula articulates with the clavicle. And we kind of talked about this joint before. Again, another really strong joint. And then we can speak about some of the ligaments that help to reinforce this joint. So the ligaments that reinforce the acromioclavicular joint is the acromioclavicular ligament. This goes from the acromion to the clavicle. And the coracoclavicular ligament, which goes from the coracoid process of the scapula to the clavicle, right? And there are two heads to this ligament, okay? So the ligaments are really important in reinforcing the joint and keeping it stable and secure as we move and maneuver the scapula, the humerus, the clavicle, etc. And as you can see, the name of the ligament is a really good indicator of what two bones are being articulated. So acromioclavicular goes from acromion to clavicle, coracoclavicular goes from coracoid process to clavicle. We can also speak about the ball and socket joint of the shoulder that's called the glenohumeral joint. This is where the scapula, specifically the glenoid cavity, articulates with the humerus. And this is where that ball and socket joint is that gives us most of the rotation of the upper extremity itself. This is secured or anchored by two important ligaments. One is called the coracoacromial ligament. And so again, this goes from the coracoid process of the scapula to the acromion of the scapula. Okay, we can also look at the glenohumeral ligament. So this has several different heads or 7 different parts of the ligament. And this is where the glenoid cavity articulates with the humerus itself. So glenohumeral ligament and coracoacromial ligament help to reinforce or stabilize the glenohumeral joint. Let's get into the muscles themselves. So we'll start by looking at the extrinsic shoulder muscle. Now, these are sometimes called the back muscles or the upper back muscles. And although they are located in the back, we do encounter them and we do consider them a part of the upper limb because they help to move the shoulder as well as the upper limb. The extrinsic ones are the trapezius muscle. So this large sort of diamond-shaped or triangular-shaped muscle here. It's one of the more superficial ones. We see this right underneath the skin. The latissimus dorsi muscle, which is really located along the flank. And then we've got the levator scapulae, which helps to elevate the scapula, right? Think about actions like extending the head, pushing the head all the way back. And then the rhomboids, minor and major, help with adduction, as well as some medial rotation or rotating downward of the glenoid cavity, okay? So the trapezius, this large muscle here. The trapezius is also important in extension of the head as well. The latissimus dorsi, which is this flank muscle here. This is really important for rowers, anyone who does a lot of rowing action with the upper body. It's the muscle that's used. If you hug someone really tightly, you can kind of feel that muscle there. And that's the general action. Then we've got the levator scapulae, which elevates the scapula. We've got the rhomboids minor, which is the smaller muscle on top, and the rhomboid major, which is the larger muscle beneath. Let's move into the actual intrinsic shoulder muscles. So we're going to separate or distinguish the intrinsic shoulder muscles because they are actually within the shoulder and help to move the shoulder proper, whereas the extrinsic muscles are really located in the upper back, but they also do help move the shoulder and the upper limb. So the first one is the deltoid muscle, and it's called deltoid because of its shape. It has this triangular or delta type shape. The deltoid is really important for reaching the hand above the head, right? So abduction of the upper limb. And then we've got the subscapularis, which is located in the subscapular fossa, and that also helps with a little bit of that action as well. Now, the muscles that I'm going to talk about that relate to the scapula, you really want to correlate these muscles to the areas that we spoke about when we looked at the scapula. So we talked about the infraspinous fossa above the spine. We talked about, the infraspinous fossa beneath the spine of the scapula. We talked about the or supraspinous fossa above the spine of the scapula. And then on the anterior view or the anterior surface of the scapula, we spoke about the subscapular fossa. And so there are 3 important muscles that can be found in these fossae, in these regions. So the subscapularis is found in the subscapular fossa. The supraspinatus is found in the supraspinous fossa. And the infraspinatus is found in the infraspinous fossa. And then we can speak about the teres minor and the teres major. Now the teres, the four muscles that I want to point out that are involved in what's called the rotator cuff are subscapularis, infraspinatus, supraspinatus, and teres minor. Together, those four muscles form what is called the rotator cuff, and they're really important in stabilizing the shoulder joint, right? You're going to often hear about those muscles together or about the rotator cuff in general if you go into occupational therapy or perhaps physical therapy studies. Okay. Let's move on to the chest muscle. So the anterior chest has a few muscles that we'll look at. The pectoralis major, this large fan-shaped muscle that goes from the humerus across to the clavicle and the sternum, right? All of this is the pec major. We also want to look at the pec minor. So the pectoralis minor is underneath the pectoralis major. So if we retract or reflect the pec major, we'll see pec minor here. And this goes from the coracoid process of the scapula here onto a few of the first ribs. And then there's also the serratus anterior, which is this jagged muscle that goes in between our ribs on the lateral side. So these are three muscles of the chest region, really important for abduction of the upper limbs. And we can sometimes see these muscles under the skin. We typically call these the pecs. And especially in bodybuilders who do a lot of chest work, these are the muscles that help to give definition to the chest region. And just to make the connection here, the word serratus anterior comes from serrated, right? Just as in this knife, the serrated edge, which very closely resembles the way the muscles interweave themselves into each of our ribs.